My name is Dr. Edmund Ickert, and I'm excited to share with you a study entitled Effective Computer-Assisted Learning Module for Retraining a Blood Pressure Assessment, a Crossover Randomized Control Trial. This study was done at Youngstown State University in conjunction with my fellow co-authors, Dr. Ken Learman, Dr. Shannon Dudash, Dr. Riblet, and from our nursing program, Dr. Calcagni. An interesting story in terms of the background for this study. As I was working on another study that looked at fall prevention in older adults, one of the key elements they assessed in that study was blood pressure. And we had our DPT students involved, and they were taking blood pressures of these older adults for data collection. And during the process, they were asking me what would be the best way for them to assess the blood pressure, what techniques should they use. And because of this, it got me thinking that there's inconsistencies with how these students were performing, and maybe we needed to look at how we were training these students more consistently so that we could see better consistent results in blood pressure assessment. So to give you a brief introduction to the study, we all know that across multiple healthcare disciplines, not just PT, there is inconsistencies with how blood pressure is properly assessed. And this has led to the recommendation that maybe healthcare professionals undergo retraining at 6 to 12-month intervals to improve consistency with assessment. So knowing this, the purpose of this study is to determine if the use of this CAL module that was developed by the American Medical Association specifically for blood pressure measurement training and retraining would be a useful tool to help keep our students retrained regularly to improve their knowledge, confidence, and accuracy with blood pressure assessment. So looking at the methods, our study consisted of a 16-week, 2x2 randomized double-blinded crossover study. We had a total of 41 first-year DPT students who participated in this study. So we had data collection at 3 different time points. One was the initial time point when the students received initial training in blood pressure assessment. There was a midpoint, which we called a T1, which occurred 2 months after the initial training. And then the final data collection happened 2 months after that midpoint period, which we labeled as the final period of T2. So at each of those time points, we assess knowledge via a quiz, we assess confidence via a survey, and we assess measurement accuracy through the use of 5 manikins, high-fidelity patient simulation manikins that were programmed with preset blood pressure values, which students had to identify through auscultation and blood pressure assessment. So when we look at the results, what we found was that really in terms of the demographic factors or the confidence survey itself, there was no difference between any time period. So the students' confidence really didn't change much at all, even with the use of the simulated manikins that we had during the actual assessment period. What we did find in terms of the knowledge was initially at that first midpoint period, we saw a statistically significant difference between the two groups. Unfortunately, we did not see that same statistically significant difference at the final time point between the groups. And lastly, in terms of accuracy, we didn't see any statistically significant difference between the groups at either the midpoint or the final period where data collection occurred. So when we look at our final kind of conclusion regarding our study, the recommendations that we put forth when looking at all 3 of those elements, the results suggested to us that really when you look at all 3, the knowledge, the confidence, and the accuracy, we really didn't see much of a change. Even though we had that one time at T1 where the knowledge was different, it didn't hold true at the second time point. So we really can't say with great certainty that the knowledge truly did change between groups when we used that module retraining, because we only saw it at one time point. Didn't see anything else with accuracy and confidence. So those didn't shift at all. So what we concluded was in our study that even though we didn't see statistically significant differences across the 3 domains consistently, especially for the knowledge piece, we still think the CAL module can be useful, but mostly for a knowledge refresher. The CAL module itself, we feel, does not work well as a standalone option to improve measurement accuracy. We still believe that the CAL module can be used, but it should be supplemented with enhanced training to improve the effectiveness of overall retraining. So that hands-on piece with the retraining, we feel would be a crucial element to still include in addition to the BP Cal module, which would help on the knowledge standpoint. Another interesting thing we found is when we looked at confidence itself, it wasn't actually an indicator of actual performance when doing the blood pressure assessment. So we wanted to kind of see also, did the confidence level of the student affect the accuracy when they were doing the blood pressure assessment? And we found that that was not the case. We didn't see any trends that would suggest that confidence affected how they performed the actual manual blood pressure assessment. So in conclusion, really that BP Cal module didn't significantly improve knowledge, confidence, or accuracy at the different retraining periods, but as a standalone option, we didn't think it was quite as effective, but with the hands-on training augmenting it, it might be something in the future to look at, whether or not the combination of that with hands-on retraining would be more effective than just using the Cal module itself. Thank you for your time. I'd also like to acknowledge, lastly, Madison Landgraf, Evan Urrutia, Emily Sia for their help in developing the study. They were DPT students, as well as Kelly Newman, who helped assist with the simulation lab mannequin setup. Thank you very much, and I hope you enjoyed listening about this study.